Okay, so this video looks at assignment 1 from the Exercise, Health and Lifestyle unit, and today we're looking at lifestyle factors. Now, the unit specification gives you a lot of information there in terms of the sorts of content, so all the examples are things that you might wish to consider including into your assignment. But essentially we've got to know the importance of lifestyle factors in the maintenance of health and well-being. So what things help keep us healthy and well. There are two assessment criteria, so we've got a pass and a merit, but essentially the big difference is describe the lifestyle factors that affect health or explain. So depending on the depth of your answer will determine which grade you get. So here's the assignment scenario, and remember you must give your answer and your work in the context of this assignment scenario. So you're employed as a sports development officer working to educate and encourage balanced, healthy, active lifestyles for the community, and that includes residents, educational institutions and employers, and that's in our local area of Hove. You've been asked to produce an information video to be placed on the council website and YouTube, and this will support the 2012 A Sport Strategy document, which is written by the council. So what's this all about actually? Now, if we ask this question, are there any cultural issues in the UK today in terms of health and well-being? One that will probably be quite obvious to you is that there seems to be a prevalence of obesity. So more and more young children, and this graph actually shows adults, have become both overweight and clinically obese. And clinically obese means that you've got a BMI score of 30 or more. And this is pretty important. I mean, the fact that this graph represents adults, we know that there's a good chance that children who are overweight or obese will remain that in adulthood. So we've got a real issue in our country in terms of health and obesity is not just the problem, because unfortunately there are a lot of associated diseases and conditions of ill health that come along with obesity, and we'll talk about those a bit later. So physical activity, participation and children. What do you think? Are young people physically active in the 21st century? Now, this cartoon actually is really relevant. So Generation X refers to the age of kids, really your age of kids, where you've grown up in a very technological world where everything is online or televised. So this really is a pun and a play on that. So the suggestion is that yes, perhaps we are more physically inactive because we spend a lot more time doing alternative activities. For example, your iPad, your PlayStation, your games, whichever. So it's just something for discussion, really, thinking about other reasons why we may be perhaps less physically active. Maybe you want to discuss the fact that we might be becoming more active. Things like the Olympics might have had a really positive effect on physical activity levels, but that's up for discussion. So task 1 asked you to research BALS, Balanced Active Healthy Lifestyles, and what it means, or what are recommendations in terms of physical activity levels. So let's have a closer look at that. What do we mean by BALS? Well, we mean a lot of things that you should do. You should have a good, balanced, nutritious diet. You should get enough sleep. You should get enough exercise. You should hopefully be free from injury if you take care of yourself. You should, feel confident communicating with others and having friends. You should be free from illness, and you should have good work-life balance. But BALS also includes some things that perhaps you shouldn't do. You shouldn't take excessive drugs, smoking, and you shouldn't be stressed. So in terms of exercise and physical activity, I'm imagining most of you will know the FIT principle, but just to remind you, this talks about the frequency of exercise, so how often you exercise, the intensity of exercise, so how hard you work when you do, the time you exercise for, so how long you exercise for, and the type that you do, whether it's aerobic or anaerobic, whether it's circuits or walking or cycling, whatever. What you need to understand and be able to explain for task 1 is the FIT recommendations for children. So it's suggested by the government and by the British Heart Foundation that young people should exercise daily at a moderate intensity, so that they perhaps could talk a little bit but they're a little bit puffed, and they should do an hour, so 60 minutes a day. And also during these developmental stages they should do some higher impact activity, because this is really important in developing peak bone density, and some strength training activity. So a real mixture of activities, but essentially 60 minutes a day. You also need to perhaps talk about adults and the recommended level of activity for adults, which is a little bit less but not a lot. So I've seen it as 3 to 5 days a week, so ideally 5, of moderate activity, but perhaps only 30 minutes. Obviously if they do more that's even better, but the minimum expectation is 30 minutes 5 times a week. And ideally what they do is use large muscle groups and do some kind of rhythmic physical activity, so for example jogging or cycling or swimming. So you need to be able to explain these recommendations. So let's look at things that might affect people's participation. Why aren't we all healthy? Why aren't we all active? And if this little acronym OPE is one way of remembering them, because it refers to opportunities, provision and esteem. And this image here really looks at a variety of colours to denote the level of adults' participation in sport. So the lighter colour is a low and the darker colour is where there is greater activity, so up to 50%. And you can see that there is quite a variation. There's a few clumps of higher levels of activity, but there's a lot of lighter, lower activity. And I guess the point from this is cultural or geographical factors might affect whether people are active or not. So it could be to do with where they live and what's available in that area, perhaps. Something for discussion and something to think about. So what other things might affect whether people participate in physical activity or not? Let's look at OPE in a bit more depth. So opportunities, this essentially refers to having the chance to participate. Now it would be great for you to come to lesson ready for discussion, thinking about what things might affect people having the chance to participate. You know, this image here gives a clue. Perhaps they don't have the time, and there are lots of other examples of that. Provision, as you might guess from this image, looks a little bit more at having the conditions or the tools to participate, to take part. So are the facilities in place? Do you have equipment? And again, there's a few more that you can add to that list. Have a think and come ready to discuss them. Esteem. Esteem is really self-confidence, self-respect, having the self-belief and desire to take part. And there's a lot of psychology involved in physical activity and weight control and all sorts of other factors like that. So again, think of the reasons that might affect somebody's esteem to stop them or encourage them to participate. All of those things affect participation levels. And then you're going to talk about, so why would we do physical activity? What are the benefits? And I want you to think about these in these 4 categories. The physical benefits of doing physical activity, and there are lots of those. So it could be swimming regularly improves cardiovascular endurance. Make sure you can give an activity and a reason why it might be a benefit, a physical benefit. Pretty much if you think about your components of fitness there, you'll get lots of clues. But there are also personal benefits, so reasons why somebody might really benefit from doing physical activity, but in a much more personal way. And that might be that they enjoy the challenge, or they might learn restraint, or learn to respect others, or they might like adventure. So those are kinds of things which are personal benefits of physical activity. Thirdly then, mental or cognitive benefits. So really to do with using your brain in a certain way. So if you do something like orienteering, where you have to figure out a route to get from A to B, which is most efficient, that is very much about decision making, problem solving, and processing information. One really important benefit of physical activity. And then lastly, something that you might recognise that you do physical activity or sport for, the social benefits, the meeting and enjoying friends, the communication skills, the teamwork, all of those other social things. So let's move on. Barriers to participation. We've talked about OPE as reasons why somebody could, but also reasons why somebody couldn't take part. So as I suggested earlier, they might not have the time or the money, they might not have the ability, the facilities might not be in place, there might be peer pressure. If your friends don't want to participate, you might not have the confidence to do it yourself. So OPE can relate to reasons why people do, but also barriers to people's participation. So task 2, you need to choose 4 of these lifestyle factors and research them and be able to explain them, the impact on people's health, and perhaps look at how we can reduce these problems apart from stopping smoking or drinking or whatever. How can we help, perhaps using physical activity, some of these conditions? Really briefly then, coronary heart disease is to do with the blocking, partial or complete blocking of the coronary vessels. Now these vessels give the heart muscle oxygen. There are also conditions where arteries become blocked or arteries become narrowed or more tough if they lose their elasticity, and those are associated diseases of the heart and the blood vessels, so you have to research those. You need to look at obesity, and there is a real trend in terms of an increase in obesity, as I mentioned earlier. So look at the sort of symptoms and the associated diseases that we can link with obesity. Obesity is not just about being overweight, it's about a lot of other clinical problems that come with it. Hypertension, so this is continual high blood pressure. Now, blood pressure will fluctuate anyway day to day, but hypertension is incredibly serious and is very much associated with the hardening of arteries. And if your blood pressure remains high, you essentially can die. It's a very, very serious condition. So you need to look into hypertension. Smoking, I'm sure you know, can be incredibly bad. See if there are any trends between males or females or age, but look into the outcomes of smoking and perhaps how reducing smoking might help us. Strategies to quit is obviously a really important process in terms of stopping also. So there are strategies available, check out those. And again, it's not just the smoking that's unpleasant, or the smell, or the look, it's the other associated diseases that are incredibly serious. Similarly with alcohol, what is the recommended daily intake? What effect does it have on us? So how can reducing alcohol intake help us? And there's loads of information on that. Stress is again quite subtle, and it can affect you not just emotionally or mentally, but physically. So research the physiological and psychological effects of stress and look at strategies that we can do to reduce stress. And then finally, diet. So obviously this is hugely linked with obesity, so look at how what we should be doing within our diet and where perhaps things go wrong. Lastly, just to mention actually, this could be linked to diet also and physical activity, osteoporosis. This is a bone condition whereby bones become very weak and vulnerable to fracture. So check that out in terms of that being a problem, often later in life, but sometimes young people suffer from this also. So lastly, there are programs out there which have been sort of laid on and initiated, sometimes by the government, sometimes by other organisations. Change for Life, I'm sure you've all seen those adverts. The MEND project is another one to look up. Look at those and see how those sit with trying to improve lifestyle and bowels. So, just to remind you, pass the merit criteria to describe and explain the effects of lifestyle factors, and you're going to make a health promotion video explaining all of this information.